Thanks for being with us here on SABC. Millions of uninsured South Africans cannot afford private healthcare. The Portfolio Committee on Health wrapped up its virtual public hearings on the National Health Insurance Bill in February this year. The committee's bid is to determine how the bill will be funded and be executed. The NHI Bill seeks to realise universal health coverage for all to allow every South African to have access to comprehensive healthcare services free of charge at accredited health facilities such as clinics, hospitals and private health practitioners. While the bill is yet to be passed, the steady increase in the uptake of market-leading affordable health insurance solutions has indicated that there is a critical need for cost-effective and adaptable healthcare medical aid. COVID-19 pandemic and the Russia-Ukraine crisis have brought the discussion on healthcare to light once again. For more on this, we're now joined via Zoom by Momentum Health Solutions Executive Damian McHugh. A very warm welcome to you. Thanks very much for joining us here on SABC News.
Thanks for having me, Flo. All the best to your viewers as well.
When it comes to healthcare, the issue of inequality, of course, comes forth with access to private healthcare, really just a dream for many South Africans. Take us through the studies and research that you've come up with. And is it possible, really, to bridge this divide and this gap and this inequality, really?
The inequality in our healthcare system is obvious, and that's why we support the NHI Bill to try and address some of those inequalities. Access to private healthcare is often done through medical schemes, and only approximately 16% of South Africans' population is covered by those medical schemes. However, there are other opportunities for us to provide healthcare cover or healthcare cover to a broader grouping of South Africans who are employed, who may find it unaffordable to join medical schemes because some of the delays in our legislation or legislative system. So yes, we do believe it's possible. We do believe we know it's possible because we've been doing it for a while, and being able to offer solutions like that to the formerly employed, I think, is absolutely critical, because what that does is it alleviates some of the pressure, in our government and public facilities. If we are able to double the membership, which is not difficult to do, we have more than 8 million people who are employed, who are uncovered. And if we can get those people onto health insurance solutions, like the ones we offer, they have access then to quality healthcare and private healthcare, and alleviates the burden on the state, which actually makes it easier in the early stages to implement the NHI system.
Let's talk then about that, Damian, these health insurance solutions that you speak of, and how they would be assisting the majority who certainly can't afford health insurance.
Yeah, I think what we found is the medical scheme industry, and rightly so, has what we call PMBs, or prescribed minimum benefits, and that sets a minimum set of benefits that every medical scheme has to provide. But it also sets a minimum price, and that price is often inaccessible for many lower income earners. So in our mind, the national healthcare system should be covering all of those people who are unemployed. What we should be doing as a private industry is offering solution sets that are affordable, but also with meaningful cover. We often see, if I can call them, and I don't mean to run anybody down, but sort of fly-by-night programs where you offer cheap solutions, but they don't have meaningful benefit. What we want is meaningful cover and an affordable price. We offer, our lowest version of the solution is at 189 Rand a month, but it still provides good quality access to providers and medication and optical benefits and things like that, which obviously help that consumer. So for 189 Rand, which is far more affordable than what you'll find in a medical scheme, you get access to some primary healthcare cover, which covers the member and its, and their families. And we think that's accessible. If you can get a price point at that sort of range, we've been doing it for a while. And importantly, I think also you've got to do it at a price point that doesn't increase by more than inflation, because people's salaries, particularly post-COVID, haven't been increasing by more than inflation. So if your healthcare solutions prices are going up by more than inflation and your salary isn't, then obviously those prices are then eating into more of your disposable income. So we've been able to, very effectively keep price low, but also keep the inflation in that price low over a period of time. And through that system, not only help the member who's buying it and the employer, obviously having more of the employees in the working economy, we also have the added ability of helping the state, because you take a lot of the burden away from the state while NHI gathers momentum.
Yeah, no doubt, people like you are in business, and obviously at the end of the day, the bottom line is the bigger issue. What I'd like to ask is this a wider discussion? What I mean is other healthcare insurers also looking at ways to be helping more South Africans, and not just really the top 5% or 10% or whatever it is that are able to put money aside so that they can indeed have health insurance.
I think each health insurer has its own purpose. I mean, our purpose very simply is more health for more South Africans for less. That's what gets us up, every morning. So given that purpose, it's one thing to have medical scheme solutions, which we do, but that doesn't necessarily provide, the more cover for less to more South Africans. We have to be able to reach more South Africans, and we feel that doing this is critical. And we've gone even one step further. We're the only health insurer that's owned by the very people that we're trying to provide cover for. Nahawu and Popcrew are big shareholders in our business, and as a result of that, it's labor owned for labor. And we think that puts us in a very unique position to understand the market very, very well, and to be able to provide cover for that market. Health is the most critical asset you have. It's more valuable than any money you have, and the well-being of South Africans will help our economy grow. The healthier our South African population is, the better our economy will be going forward.
Yeah, and let's talk about this issue of NHI. Of course, it's been ongoing, and the government has been debating it for some time. And if I remember correctly, the former health minister, who was Dr. Aaron Motsoaledi at the time, was really pushing for NHI, spoke about the fact that he was getting a lot of pushback from a lot of the healthcare insurers. And an example that I remember him making was that, hospitals, for example, doctors or whoever, are able to put a markup on medical equipment or medical tools. For example, a syringe, which the normal price would have been, let's say, 10 Rand, they can easily then put there on the quotation for 100 Rand. I mean, things like that are really actually quite unacceptable, because healthcare is, it's a right, it's a fundamental right. Is it correct to say that there continues to be, or is there pushback when it comes to NHI? I mean, this debate has really been going on for a long time. I mean, the fact that I'm talking about a former health minister should really say something to that.
No, sure. It's very complex. I think putting NHI, in countries like Germany, it's taken 125 years. Now, I'm not saying it will take us that long. I think we've got some really strong capabilities in South Africa. If you just think of our recent past, our young democracy, and we've been able to do things that many other countries haven't been able to do. But it's complex. It's complex because we don't have an oversupply of providers in South Africa. We've got an undersupply of providers. It's complex because we don't have a big tax base where everybody's employed. We've got a smaller tax base with high unemployment. So, it's not a simple thing to get right. I do believe that NHI is something that we do need as a country. And in fact, we're not pushing back at all. We really believe that we can work together with government to make a healthcare system better for all South Africans. The private industry needs to look after the people that are employed in the private market, and they need to do that in the short term. I'm not saying this is a long-term positioning. It's definitely a short-term position. Let's help alleviate some of the burden and let the money that government has already earmarked for public healthcare stretch further, and stretch for the South Africans that it's there for and there to cover. And let the private industry cover the private people that are employed formally in South Africa. And that's what we're looking to do, both through the medical schemes, but also through our affordable healthcare solutions in the insurance market. And we need to legislate correctly that allows that, in the short term at least, to flourish, and allows it to be managed correctly. Because what we don't want is also consumers to buy into, let's say, less sustainable solutions, and then they fail, and then their view of healthcare and private healthcare is also negative, or they have a negative perception about it. So I think we've got opportunity for legislative reform to be done in the correct way in this NHI process, and I think we'd be silly as private healthcare insurers not to back it. I'd be surprised if many of our competitors wouldn't be backing it. I think it's the right thing to do, but it's got to be done in the right way. It must be done sustainably. We don't want it to fail, and collect the correct amount of money for the level of cover that we need to provide for the rest of South Africa.
Damian,
it shouldn't, like you said, it's not a right.
Yeah.
It is a right. It's not a privilege.
Exactly.
Absolutely.
All right, Damian, a great pleasure talking to you. Thank you so very much for giving us your time. Informative indeed. Thank you.
Thank you. Have a good weekend.
You too. That is Damian McHugh, who is executive at Momentum Health Solutions. Well, IMF World Bank meetings were eventful this past week while they tackled a number of global agendas. The Russia-Ukraine war was in the foreground of talks, with Western nations continuing to pledge their solidarity with Ukraine and promising the country continued military and financial support. A group of high-profile ministers from the United States, the UK and Canada were among some who walked out of the talks where a Russian representative was speaking. And the ongoing conflict was blamed by the IMF for a downward revision in global growth for this year.
The Russia-Ukraine war was a constant shadow in global discussions at this year's IMF World Bank spring meetings. Due to a lack of consensus on a number of issues, the traditional joint communiqué, usually sent out after these meetings, didn't happen. Even the G20 meeting, of which Russia was a part, which happened on the sidelines of the IMF, could not issue a joint communiqué. But there were discussions about the future of the IMF and World Bank organizations in a changing world. US Treasury Secretary Janet Yellen joined a band of progressives calling for major reforms at the institutions, adding that they were never designed to deal with the multiple challenges the world now faces.
We face challenges that require investment on a scale that an international institution can't manage on its own, like climate change. And the investments needed for climate change will add up to just trillions and trillions of dollars.
Other major issues facing the world, like the ongoing COVID-19 pandemic, higher inflation and emerging countries' susceptibility to falling into a debt trap, were also high on the agenda. IMF Managing Director Kristalina Georgieva spoke to these issues.
First, end the war in Ukraine. Second, continue to confront the pandemic with a comprehensive toolkit that includes vaccines, testing and antiviral treatments deployed everywhere. Third, tackle inflation and debt. Central banks should act decisively and communicate clearly. Spending must be carefully prioritized and targeted. Some countries will require debt restructuring. To help them, the G20 common framework must be improved.
And during the week, the IMF released its World Economic Outlook report. It forecast global economic growth to slow to 3.6% in 2022, compared to its earlier estimate of 4.1%, blaming the Russia-Ukraine war for curbing growth and inflaming inflation even further. Nampumelelo Siziba, SABC News, Johannesburg.
The delay in moving the liquid fuels tank farm from the port of Port Elizabeth to the NHI harbour and the planned closure of existing tank farm jeopardized the operations of the Orion engineered carbons. But a collaborative project between OEC and the Kucha Special Economic Zone is providing a solution for the bulk supply of raw material to the producer. The project, worth 265 million rand, entails the construction of two 18,000 cubic meter storage tanks and the required infrastructure in SEZ for the storage of carbon black oil that will be delivered through the port of NHI. OEC is the only local producer of carbon black, and